maternal health as well as, of course, child health at the center of our conversation. Yes, so today we are discussing understanding maternal health, the hidden crisis in our communities. Yes, that's the conversation we're having today. And I have the pleasure, the honor of being joined by Dr. Modupe. Yes, Dr. Modupe Adedeji. She's popular. If you are there on social media, if you're out there on social media following her, you will know because I've seen a lot of her content online there. Yes, that was why I was wowed when the camera came on. I'm like, oh, okay, she's even the one because this is the outfit, the maternal no, that's not the health. Yes, this is the uniform she wears on social media. So this is why I was so startled when she came on. Even she's nodding right now. Yeah, so I'm honored. Okay, something is playing and I'm trying to check that. Please bear with me, Lagos. Apologies. But of course, I can already confirm my guest. Yes, Dr. Modupe Adedeji, your camera appears to be upside down. You might want to kindly adjust that. We'll be going on a short break in about 20 seconds, but let's Lagos hear your voice that you're already here, you're joining us. But if you're not comfortable yet because you're still trying to adjust the camera, it's okay. But can you talk right now? Can you say hello to Lagos?
Yes.
All right.
Yes, good afternoon. I didn't know that you know my face and then identifying my uniform. Actually, it's not a uniform. I'm just coming out of the theater as I always am.
Okay.
Yes.
Okay.
Yes. So I'm Modupe Adedeji, a gynecologist and an obstetrician. Yeah.
All right. Yeah. So you just heard a voice. I'll be going on a short break. But before then, let me tell you that Dr. Modupe Adedeji is the General Secretary, Society of Gynaecology and Obstetrics of Nigeria, SOGON, Lagos State chapter. So we'll be back right after this time as doctor. Please stay online. Thank you so much, Lagos, for staying with us.
Who will rise? Who will fall? Who will be champion? November 10th, 2025. Lagos's voices, Lagos's future, Nigeria's best of the best. The best. For sponsorship inquiries, email info@nigeriainfo.fm. That is info@nigeriainfo.fm. I beg to differ. The tournament of champions.
Every day is about winning with one play on Nigeria Info. On Nigeria Info, daily winnings is now over 150,000 naira. Just go to oneplay.ng or dial *347 *880 *3#. Play with as little as 500 naira, and in a few seconds, your ticket is in the draw. The more you play, the better your chances of winning every day on the Morning Fire, What's Up Lagos, and Game On shows on weekdays and Football Frenzy shows on weekends. But that's not all. Every Friday, there will be a 500,000 naira jackpot. Playing during the week automatically qualifies you for the weekly jackpot. Your chances of winning are the same whether you play on oneplay.ng or dial *347 *880 *3#. Remember to play responsibly. Not suitable for persons under the age of 18. OnePlay is a registered trademark under Lasho Trading Services Limited, licensed by the Lagos State Lotteries and Gaming Commission.
Are you finding it difficult listening to your favorite talk radio, Nigeria Info, via the mobile app? Come closer. Let me fix that for you. Now, launch the app on your device. Click the 3 lines on the top left corner of the app. Look for settings in the drop-down menu and click on it. Turn on the first option that you see. Make sure you turn on the option that says always use highest quality available audio. Now that you have done that, close the app and relaunch it. Voila! I did it! Well, sorry, you did it. Now you can enjoy your radio anywhere, anytime. Nigeria Info, Let's talk.
The voices that speaks the truth. Live from the heart of the conversation.
I think there's nothing that has strained our nerves like this concept of unity.
Politicians who are pushing out this narrative, they are not tribalistic, but they are making you tribalistic.
Nigerians have expressed outrage over the certificate forgery by Nigeria's Minister of Science and Technology.
Same-sex marriage, Church of Nigeria rejects election of new Archbishop of Canterbury.
That the people that are killed in the Boko Haram or terrorism across this country are only Christians. That is unfair.
We are complaining. Election will come. We will still collect 1,000 naira and still vote for the same people.
Gas was to be sold by Modupe at 800 naira. It's all these gas dealers that block it.
Match your actions or match what you are saying with reality.
Stay with us. More coming up on 99.3 Nigeria Info. Let's talk. This is
Maternity Line.
Maternity Line.
Lagos, join the conversation. The conversation is understanding maternal health, the hidden crisis in our communities. Every day, Lagos, every day in Lagos, women leave home pregnant, but some never return. And the tragedy is, many of these deaths never make the news. Okay? They never enter hospital records and never get counted. They happen quietly in traffic, in homes. It might not be reported. Don't get it twisted, okay? In prayer houses, it happens, and in the hands of unregulated birth attendants. You remember them on the show? And that is why maternal mortality in Lagos is called hidden crisis, according to my research. Okay? Today, I am joined by the right person to be on this conversation with me. This crucial conversation, Dr. Modupe Adedeji, General Secretary, Society of Gynaecology and Obstetrics of Nigeria, SOGON, Lagos chapter. She joins via Zoom and will be unpacking why maternal deaths are still happening in Lagos to start with, how anemia and postpartum hemorrhage, that's PPH, contribute to these losses. What are the early warning signs family and pregnant women must never ignore? Also, the role of culture. Culture is such a big thing, no? Culture, poverty, and delayed access to care. Access to care. What can be done in homes, health centers, and policy circles to save mothers' lives? And of course, guess what? We will be touching on how the use of tranexamic acid drug, that TXA, helps to reduce maternal mortality. Dr. Modupe Adedeji, I am glad to see you, to have you here on the show today. Thank you for honoring us.
Yeah, thank you.
All right, so
Thank you so much. Thank you for having me.
you're welcome, Doctor. Doctor, research makes us understand that there are 5-part series on the most reported leading causes of maternal death in Nigeria, which are hemorrhage, preeclampsia, sepsis, post-abortion complication, obstructed labor. We've had discussions on some of these already. Now, according to the 2023 UN report on trends in maternal mortality from 2000, that year 2000 to year 2020, nearly 28.5% of global maternal death happened in Nigeria here. That report further states that a woman in Nigeria has a 1 in 19 lifetime risk of dying during pregnancy, childbirth, or postpartum. Whereas in the most developed country, the lifetime risk is just 1 in 49. 1 in 4,900. Yes. In developed countries, the lifetime risk is 1 in 4,900. Now, doctor, tell us, what does maternal mortality mean? And why is it still a major challenge in Nigeria today? And Lagos is still in the cuts.
Yes. It's actually quite pathetic for a woman to die just because she's carrying out that task that has been given to her naturally.
Okay.
So, because when you look at it, is it supposed to be that it's a crime to be a woman? Because you are crying a baby, and at the end of the day, that task that you're doing, you die from it. Just the natural task. It's actually appalling. It's actually sad. And the common causes, as I have earlier outlined, are some things that are very preventable. Maternal mortality is actually the death of a woman during pregnancy, during labor, at delivery, or even 42 days. That's 6 weeks after delivery. So all that captures during the antenatal period, during the time she falls into labor, even when the baby is coming out either from the vagina or from the abdomen, and even after she has been delivered, even it covers up to 6 weeks after that. And this death could actually be from complications of that pregnancy, what the pregnancy costs, the changes the pregnancy did to her body that caused complications, or even from the management of that pregnancy in the course of her pregnancy period and delivery and the likes. So don't entertain probably she's got pregnant and then she had a road traffic accident. So that's on the side, But the fact that it is that pregnancy that started the journey to her death, which is not supposed to be. It is not supposed to be. So the noise is actually that we don't want our women to be dying just because they are carrying out their natural given responsibility. The men too, they have their responsibility as well, and they don't usually die from that. So why should a woman die from getting pregnant, So it's quite very painful, as I said before, because the common causes are things in this part of the world, underdeveloped countries, so to say, third world countries, that's what we are referred to. There are deaths happening from things that are preventable. You mentioned them, 5 common ones.
Right.
Let me start from the rear. That's abortion, unsafe abortion,
We're coming to that next week.
I was in a program just a few days ago where we're talking and ironing about unsafe abortion and the fact that we are not still accepting the fact that people are dying from that. Then following from behind, as I said, we talk about hypertension disorders in pregnancy. Not that the woman was hypertensive before. Just because she got pregnant, she started having blood pressure. And because of one reason or the other, maybe the pregnancy itself or even the management of that blood pressure, she died from that.
She's talking about
another one is, labor, obstructed
labor. Yes.
It happens that the baby, even though of normal size, because we usually think of bigger babies that may not be able to pass through the pelvis, but at times they are even of normal size. It's just that the baby did not place itself well in the birth canal, even though the head is down, and then it's not possible for the baby to come out vaginally. And then labor goes on and on and on, all because we are determined that we have to have a vaginal delivery. Right. We do not want to be delivered by the knife, by cesarean section. And all that starts off and then is the journey towards death. At the time they then tend to present in the proper place, it may have already been obstructed and there may be little to be done at that point in time.
What could have been
then
prevented?
To cap it all is not, before the last, which we were paying attention to today, is infection. Infection, all that. So you can see why it is so much a problem of the third world countries. Because we are not only saying that our environment is not optimal, but which environment is labor taking place? Which environment is delivery taking place? Who is the person taking the delivery? Some people just say, deliver at home, call a nurse, come and take my delivery.
Also
or
new.
because we want it to be quite cultural. Traditional people have been doing it. They've been doing it even before the white people came to our environment. So why can't we embrace our culture? And then you now find people that are putting their hands inside the vagina, trying to see if the baby is going to come and all that, and introducing infection. And then they set the ball rolling for infection, and then the journey, if not well managed as well, the journey towards death of a woman. The first test I would want to say out of all of them is bleeding, of which at the end of the day, all the ones I've even referred to entails bleeding. Entails bleeding at the end of the day. It may actually be bleeding that results into bleeding starts off, and all the management of it results into sepsis. Or because the woman was in labor for a long time, obstructed labor, she even tears her uterus, that's ruptured uterus, and then she starts to bleed. Or even I've talked of hypertension that eventually can even cause complications that we call disseminated intravascular coagulopathy, where the woman cannot clot anymore. That means she'll just be bleeding, and the blood is not clotting, and that's it. Then the other causes of hemorrhage. Now, put under the umbrella of postpartum hemorrhage. You can see that all is hemorrhage at the end of the day. So we cannot but discuss hemorrhage as one of the major causes of maternal death. And it's something that we should pay attention to, and obviously know our skills, perfect our skills very well, make use of necessary intervention so as to prevent our mothers from dying from this condition.
Now, thank you so much for all that have been said so far. I like the fact that you emphasize the bleeding part, and of course the obstructed labor part, and several others that you already spoke. I mean, you spoke about, and I would love for us to now go back to the bleeding, the hypertension, the hemorrhage that you spoke on earlier, and I'm tempted to ask, what are these major causes of maternal death, and how do anemia and of course the PPH fit in?
Okay. Yes. So PPH is postpartum hemorrhage. Yes. So hemorrhage means bleeding, really. Bleeding. When we are talking about postpartum hemorrhage, so we are talking about bleeding from the birth canal during after delivery.
Yes, that's
basically
right.
That's why it's called post. After. We have what we call antepartum hemorrhage as well, but we are talking about postpartum hemorrhage today. And when there is hemorrhage, that means blood is being lost. At the end of the day, the blood in the body, let me use the colloquial language by saying it will be short. It has to gauge. If it doesn't gauge, then you will not be optimal. So if it's short of what is supposed to be gauged, then it is called anemia. And anemia means that there's reduced blood in the body, meaning that every organ of the body is going to suffer reduced blood availability. And we know what is important about blood is that it's the oxygen carrier. It carries oxygen to every part of the body. That is energy. Energy for me to blink while I'm even talking to you, closing my eyes and opening it. It takes energy for me to get that done. Talk less of every other part of the body. The heart also needs energy to pump. The heart needs energy. The lung needs energy to breathe. So you can imagine when we say a patient is anemic, that means that organs can start to fail. And if it's not corrected on time, then that means that it can cause the organs to fail. And when the organs fail, then that means it is death. So that's why we are really talking about postpartum hemorrhage. Postpartum hemorrhage actually has two broad types. And before I talk about the type, it means that the bleeding is coming out, as I said, from the birth canal at a volume beyond expected. Because on a normal day, a woman should bleed at delivery. But then when we are not seeing blood that is beyond the expected, then we are worried and we know that there's a problem. For instance, when we talk about, we name it postpartum hemorrhage, when a woman delivers from the vagina and he has started losing about more than 500 mils of blood. And that can be related to a pure water sachet. I think that takes 500 mils. Yes. Once the bleeding is getting beyond that, 500 or more, that means it's already postpartum hemorrhaging after delivery. And when the woman is going through cesarean section and the bleeding is getting more than 2 pure water sachet, full pure water, that's 1 liter, 1 liter, that means that a lot of blood is being lost. And the body will soon start sensing it. The organs of the body will soon start sensing it. So we need to quickly replace that loss. And then, peradventure, we have to do even more important surgeries, like even having to do a cesarean, removing the uterus alongside by managing probably any problems. And the bleeding is now getting more than 3 sachets of pure water. That's more than 1.5 liters, 1,500 mils. That's postpartum. Well, that's a definition for medical students, so to say. So we are particular about deliveries that take place anywhere. At times, even delivery can happen at home without you actually planning that, which usually is not supposed to be common. But we can entertain that on what we call precipitate labor. And then the bleeding, the baby comes out, the placenta is supposed to be out and not out completely. Then the woman is bleeding beyond a pure water sachet, as I said. I'm emphasizing that so that we can relate to it. And that means that's postpartum hemorrhage. So I said that there are 2 types. We have primary postpartum hemorrhage and we have secondary postpartum hemorrhage. So primary postpartum hemorrhage is actually that one that needs prompt attention. When we talk medically, we say it is an acute state. You have to quickly identify the cause so that you can quickly resuscitate and the patient will be good for it. And that's the emphasis of delivering in a good center, in an obstetric center, where there is avenue of blood available and even a theater available in case of surgical intervention needs to be given. So if it's a postpartum hemorrhage, the causes can outline from probably there's a trauma. After the baby comes out, the baby tears along the birth canal. It can be a trauma on the vagina outside itself, which is quite obvious.
So true.
It can be trauma on the cervix, and even trauma on the uterus itself, the womb itself, and the patient starts to bleed. If these spaces are not identified on time, then the bleeding goes on and on. Another common one, which is even the first I should mention, is that the baby comes out and all of a sudden the uterus forgets to contract. As in the uterus does not remember, because the normal mechanism is that as soon as the baby comes out, the uterus should be trying to go back to its normal size before it was pregnant. So that happens gradually, but there is a suddenness of the fact that the baby is out and the uterus goes back to its normal, trying to go back to the normal size. It helps to close up all those vessels, blood vessels that were supplying the placenta and the baby while they're there. So as soon as it contracts, those blood vessels close up. That's the first method, and the bleeding will reduce. And at the same time, the uterus will now be going back to its normal size. But unfortunately, the uterus just forgets to do that. And we know when we observe that, we are usually ready for things like that, because it can be a common occurrence in women who have delivered severally. We call them grand multiparous women. The uterus has been used. It can just happen. Another thing is when we make use of some medications, it can even help to just make the uterus just forget use of it without knowing. Can cause those kind of things, and the human starts to bleed. The placenta is supposed to be inspected immediately it comes out, and a remnant is left within. So we call that retained product, and the woman keeps bleeding. So if it was not inspected and you did not even see that it's not complete, you just observe that the woman is bleeding. I think I've mentioned disseminated intravascular coagulopathy, which is a complication of all these 3 that I've just mentioned, that when the woman keeps bleeding and bleeding and keeps bleeding and bleeding and is not being arrested, that means all the clotting factor that is helping to clot can also be exhausted. So she will not be able to clot blood again. It's a mechanism of stopping blood instanta. So she just continues to bleed. So all these 4 are causes of primary postpartum hemorrhage. On the secondary aspect, I know you want to stop me. Let me just talk about the secondary aspect.
Briefly.
That is actually called much more beyond 24 hours. It's primary when it is the first 24 hours of delivery. But when it is beyond 24 hours of delivery, then we want to think of other things which may even emanated from the primary, that was not just obvious in the first 24 hours. But the commonest of that group is actually from infection, which may even arise from the fact that the placenta, though did not bleed so much, but now started bleeding after 24 hours, and infection is now setting in because of the product that is left.
Doctor,
so you can see that you have to just deliver in the right place.
Thank you, Doctor. I know we can stay on this because there's so much to unpack and we still have many more. So you have spoken about problems. I mean, ways to identify and what causes of maternal death. It's also important to know for you to please make us understand ways the bleeding can be arrested. I mean, after delivery, and what is the evidence for tranexamic acid, because I understand that the WHO recommends using the TXA as a part of standard treatment for PPH. So, but before you answer that question, Doctor, I'd love to bring Lagos in on this conversation in case they are making notes and they would love to ask a question. Also, please, I'm getting a message that your camera needs to go down a little because your face isn't showing properly. Thank you so much. Yes, I think it's better now. Yes, this is better. Precious, I hope you're watching, so it's better now. Doctor, please, while you are attempting to answer the question, Lagos, this is an avenue for you. If you are a woman, or if you see a woman who starts bleeding at night in your neighborhood, who helps her before she gets to the hospital? Have you witnessed any before? Have you seen anyone before? Have they even talked about any woman who bled at night, or even maybe daytime, and before she got to the hospital there was help? Right? You can share their experience with us. Also, how many pregnant women around you are seeing prayer houses or perhaps maybe TBAs instead of doing the way it should be done by going for their antenatal? If you have seen, or if it ever happens to you, or if it could even be your wife, tell us. And then, should Lagos still be losing mothers to bleeding and anemia when drugs like TSA and basic antenatal screening exist? We need you to jump on this conversation because it's all about our women. It's all about us. It's all about you. Also, if you are hearing tranexamic, tranexamic acid or drugs for the first time, also let us know, okay? Because according to WHO, it helps to reduce maternal mortality. Let us know if you're just hearing about it for the first time. Numbers to call 0201 277 0993, 201 465 7190. WhatsApp number is 0809 597 5805. Now, doctor, let's go back to my question. What are the ways bleeding can be arrested after delivery, and what is the evidence of TXA acid according to WHO?
Okay. Yes, thank you very much, and thank you for giving me that long period to be able to tell you the various causes of postpartum hemorrhage. So, because those causes must actually be ruled out.
Yes,
you must actually identify which one of them, and even before you start engaging whatever you would like to engage, because each of those causes has its way of management. For instance, starting with the one that I said could be more common. And that's the one that the uterus just forgets to contract. We call it uterine atony. In that case, you ought all what one needs to do is to look for modality to make that uterus contract, and you have to rub the uterus. We have a way we rub the uterus, and then uterus just remembers, oh my God, I'm supposed to contract, and then it starts to contract. But then we have to make use of medication. We call them oxytocics, like oxytocin and the likes. And all that, when we start noticing that this bleeding is getting a lot, even before then, it's actually getting appreciable. That is when we actually also remember our tranexamic acid. And what does tranexamic acid do, actually? It helps to it helps in blood clotting. You know, I've been talking about clotting. It helps the clotting factor. It helps the blood to clot. And it's a very important mechanism when blood is even coming out from any part of the body.
Okay.
Really. But we have enjoyed and we have evidence of its effects when it's being used during deliveries, especially when you start noticing that this blood is becoming excessive from where it's supposed to be, you know. And then it goes along with even all the other reasons for bleeding. Is it because everything at the end of the day causes bleeding? And one thing that you want at it all is that there should be clots going on. That means there should be the clotting of blood should keep going on. It will help to arrest the bleeding at some sort as you are attending to what may be the problem. For instance, if it's a tear, a cut along the line of delivery, the birth canal, then while you are even getting to repair that, you also appreciate the fact that the blood is clotting even as you are repairing that cut. I know everybody identifies when you have a cut, even from an accident, blah, blah, a cut on the body. Blood keeps going. Exactly what I'm explaining when it comes to the birth canal, when there's a laceration. We call it laceration, you know, when there's a cut. So while you are repairing, you enjoy the fact that clotting is also occurring. And that is one thing that tranexamic acid helps to encourage when it is being used. And that is why it is usually supposed to remain in our emergency trays. It should be a part of our drugs, even in our labor wards, when we are taking deliveries. Doctor, because you may not even be able to identify which woman will suffer bleeding after delivery.
Doctor, I have a message here from Folashade Johnson. She's messaging from House and Right. She says, good afternoon. All thanks to doctor for explaining the TXA. I've heard about it before, but I'm wondering if it's something our women need to ask when they are at the point of delivery, or is it very unnecessary? Folashade Johnson from House and Right.
Okay, that's a very good question. We are now living in times where people are getting to know things. You know, information is everywhere.
Oh, doctor's internet appears to be freezing. Okay, I lost a couple of calls. If you're trying to call in again, 0201 2770993. 0201-465-7190. If you have any question at all on this topic, perhaps you don't understand or you love to understand, the doctor is back on. Her internet was previously freezing. It went frozen. Doctor is back. Now is the time. You can call back. Doctor, please go ahead. Are you still on Folashade's?
Yes, I'm still on Folashade's questions.
Okay.
I said you have a right to ask. Do you have tranexamic acid? Part of it is also to ask, in this hospital, do you do surgeries? Do you have a theater? Do you have a blood bank in case I'll be needing blood? These are very germane questions to ask. Do you have oxytocin? Yes, we are talking tranexamic acid today. Yes, it's a question to ask. I've heard on the radio. I've read about tranexamic acid. I've heard on various social media platforms people talking tranexamic acid. Please, do you have tranexamic acid in your facility? And it's a good question to ask.
Okay,
yes.
I have another one from Ayobami Olashopo. Ayobami Olashopo says, good afternoon. I had a very horrible experience years back with my wife. Sadly, I lost her. We were told that she was going to give birth through CS, but over time we discovered that she could born the child by herself. So it went on and on for long, but almost 48 hours later, the doctor insisted that she should be operated upon. And after the operation, the doctor said if it carried out, after the operation, the doctor said if they carried out another surgery, because she also had fibroid. She also had fibroid before she conceived. She was diagnosed, but eventually we lost her. It's a sad story that I don't even want to talk about. Sorry about that, Mr. Adedeji.
I'm sorry about that.
I'm so sorry.
So having fibroids with pregnancy, is a very, very important condition. And I'm happy for this example because there's a lot of myths out there that people think that once you have fibroid, you may not be able to get pregnant again. And this is a woman that had fibroid that got pregnant. I'm sure probably the child is alive, But there are other things that fibroid can be a cause of, where we doctors tend to say we need to remove the fibroids before a woman gets pregnant. It may not just because we may be thinking the fibroid may be in question for not getting pregnant, but it's because of this bleeding, because of this hemorrhage, because it can be responsible for the baby not even having to be in a proper position for delivery, which may necessitate cesarean section. And at times you get away with the baby being delivered vaginally. So far, this fibroid is not on the route or the way to deliver, the way to come out, the entrance, so to say, where the baby will come out from. I just want to use words that I'll ensure that I'm communicating with everyone, But then after that delivery, because of the intervention of the fibroids within the uterus, it may not give us an effective uterus. The effectivity of uterus is the ability to contract immediately the baby comes out, immediately the placenta comes out. But because it has a fibroid that is also entertaining, that contraction may not be good enough, and it's one of the causes of uterine atoning that I talked about.
Okay.
And patient can start bleeding.
Patient
can start bleeding for.
Okay, he just dropped another message saying, okay. I'm sorry, doctor, I'm trying to hurry you up because of time, because we are totally out of time, almost out of time. He dropped he dropped another message saying my daughter is alive and she's 7 years in the next couple of months. Congratulations, and sorry about the loss of your wife. Doctor, what should listeners take away from today's discussion to help save mother's life? Because I was unable to exhaust all my questions because of other explanations that we needed to get from you.
Okay.
So what should...
I'm sorry, the postpartum hemorrhage is actually a big one to talk about. It's a talk that I can have for weeks, So the takeaway here is that it is very important to have an antenatal clinic done, and risk for developing postpartum hemorrhage can actually be picked up from antenatal.
All right.
And goes on like that even to delivery. Then who is taking your delivery? That means the person must also be skillful.
You
must be taking. So sorry.
All right, doctor. My sincerest apologies. We are out of time, and I know that this is not just a one-off conversation. We are going to continue in subsequent episode. Hopefully, we're able to have you back. Thank you so much for your time today. And Lagos, it's time for the news, and Bolu Atife is live in the studio. Dr. Adedeji, thank you for your time. May God honor you. All right, doctor is waving. All right. Lagos, stick around. It's time for the news. We'll bring back conversation again. Stay here.
The news update on 99.3 Nigeria Info. 99.3 Nigeria Info. Here's the news. The divisions within the People's Democratic Party are deepening. The Federal High Court in Abuja has temporarily halted the party's planned national convention, which was scheduled for November. The presiding judge issued an interim order freezing all convention activities pending the outcome of a lawsuit challenging the party's leadership structure. Some party members are calling for the removal of the acting national chairman, Umar Damagum. The case has been adjourned to October 24 for further hearing. Reactions are coming in regarding the appointment of a new INEC chairman. Afam Musigwe, the president of the Nigerian Bar Association, has stated that he wants Professor Joasha Mukwiton to perform his duties in the best interest of the country, regardless of who nominated him.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.